Month is National Stomach Cancer Awareness Month.
WENY's Dan Berman joins us live in studio this morning with more on the different types of this disease and ways we can prevent it. Good morning, Dan.
Yeah, that's right, guys. Well, the American Cancer Society estimates there were about 26,500 new cases of stomach cancer this year. I spoke with internal medicine specialist Dr. Michelle Bernstein to learn more about what causes the disease and some ways we can help treat it. November marks National Stomach Cancer Awareness Month, with new cases affecting roughly 15,000 men and 10,000 women in 2023. The most common type of stomach cancer is adenocarcinoma. However, there are other types of ways to identify the disease.
We can also classify it based on location within the stomach, and there are also different types of tumors which may be related to lymphoma, gastrointestinal stromal disease, or metastases.
When trying to detect if someone has the disease, a patient may or may not have symptoms. Typically, if someone is seeing symptoms, it could mean the start of the disease.
So if we identify a patient that's having symptoms such as unintentional weight loss, persistent abdominal pain, or symptoms such as nausea, bloody stools, or even seeing on lab work that the patient has anemia, we can go ahead and get imaging such as a CAT scan, but the best test is an endoscopy.
If any, some treatment that is recommended for this.
First, we need to determine the extent of the gastric cancer. If it's localized within the stomach, we might also need to do an endoscopic ultrasound, similar to an endoscopy, but with an ultrasound at the end to see the depth that the tumor has invaded within the stomach.
If the cancer gets to the point of progression past the stomach, surgery is then recommended.
As surgery is usually what is recommended, as well as conversing with our oncology colleagues who will determine if chemotherapy and radiation will benefit.
And Dr. Bernstein says if you were experiencing any of the symptoms as just mentioned, the best thing to do is to contact your primary care doctor right away for a checkup to determine if further testing is needed. Kurt and Crystal, we'll send it back to you guys.
Dan, thank you. Well, coming up on